Hi, this is Dr. Mike. We're here for another post-rehab tip. And instead of a tip, I'm actually going to kind of share with you my story with regard to how we started teaching these medical exercise specialists and essentials of post-rehab fitness courses. I'm a physical therapist. I've been one now for 23 years. Years ago, we had a patient that was referred to us by a physician after he had gone in and done a shoulder stabilization procedure. This client had a series of shoulder dislocations, so she had a chronically unstable and dislocating shoulder. We treated her for a number of sessions, and we actually discharged her about 4 to 6 weeks later, and she was actually doing very well. She got most of her shoulder range of motion back, but she did not get back all of her external rotation. Now, the interesting thing is, for us as humans, we don't do much with external rotation. So for this young lady to lose some component of her external rotation wasn't a big issue. And actually, that loss of external rotation was essential in stabilizing the shoulder so she did not continue to dislocate the shoulder. Well, after we discharged her, she called me back about a week or so later and asked if she could get started with an exercise program with a personal trainer. Now, this was in the early 90s when personal training was first becoming kind of a known entity here in North America. We said yes, and I asked the client to have the trainer call me just so I could go over the exercise program. I told the trainer to not work on increasing external rotation, but to work on strengthening the rotator cuff for both shoulder external rotation and internal rotation. Well, anyway, to make a long story short, the patient calls back in about 2 weeks and she's complaining of excruciating shoulder pain. She comes into the office, and there was an orthopedist on the second floor. She comes into my office, and it was the orthopedist that referred her that was on the second floor. She comes in, I examine her, and she's in significant pain. I send her upstairs, and the orthopedist gets an x-ray, and he finds, lo and behold, the bolt he had put in her coracoid process to stabilize the shoulder. She had taken a piece of tendon and wrapped it around, was now pulled out of the coracoid process. We asked the client what happened. We figured she had fallen or done something unusual. She said no, the trainer was trying to work on increasing external rotation. Now, originally we were livid, hot, mad, and we were really pissed off about this. But I realized later on that evening that the trainer just didn't know. So as a result of that, we figured as medical professionals it was important for us to step forward and put together a series of workshops that train the fitness professional how to manage the medically based client. Now, at that time, insurance reimbursement here in the United States was dropping significantly, and our population was getting older. So it was the perfect time to develop a program for fitness professionals to learn how to develop safe and effective programs for neurologic, cardiovascular, and musculoskeletal clients after their discharge from physical therapy. So 14 years later, we're still offering these programs around the world. We now offer the medical exercise specialist certification, the post-rehab conditioning specialist certification, and the medical exercise program director certification. So that just gives you an idea of where we started. If you want to get more information on our programs, please visit our website at www.postrehab.com, or if you have a question for me, email me at drmike@postrehab.com. That's drmike@postrehab.com. Thanks again for listening in, and best wishes in building your practice.